Good morning, this is Emily at Thrive Medical Spa. I have a setup right here for one of our pellet patients that we're going to be doing later, so I wanted to talk y'all through what I have on my tray. So we'll start with some numbing medication. This is just lidocaine and epinephrine and a little bit of bicarb that helps cut the sting. Right here we have a blade. My pellets are off camera over here. I haven't put them in my container yet, but I'll put them in here. And then this is just a ChloraPrep to help cleanse the skin. So this is how, it's called a trocar, or a hollowed out larger needle. And we use this to insert our pellets. So this portion goes into the skin, and then our little pellets go right here, and then we push them through. And then once that's all finished with, we take and put a little bit of a pad on you, some steri strips, and then a big old band-aid, and you're finished.